So, let's talk about a condition that affects millions of people all over the world, type 2 diabetes. But what's really going on inside your body? We're going to dive right in and break down the science, see how it all gets started, and most importantly, talk about what you can do to take back control of your health.
So here's how we're going to tackle this. First up, we'll get into the basics. What even is type 2 diabetes? Then, we'll look at the tipping point, what causes it and what signs to watch for. After that, we'll jump into how to manage it, and we'll wrap up by looking at the long game, why it's so important to get a handle on this.
Okay, so what exactly is type 2 diabetes? To really get it, we need to zoom in and take a look at what's happening with your body's cells and its main source of energy.
At its core, this is a condition where your body just can't properly use its primary fuel source, and that's glucose, the sugar you get from the food you eat. Normally, that glucose powers everything you do. But with type 2 diabetes, that fuel gets stuck. It can't get where it needs to go, so it just builds up in your bloodstream, and that's where the trouble starts.
Okay, to make this super simple, let's use an analogy we're going to come back to a few times. I want you to think of insulin as a key. In your body's cells, they're like millions of locked doors. Insulin's whole job is to unlock those doors so the glucose can get inside and give you energy. When it's all working smoothly, it's a beautiful system.
Now, what's so interesting is that type 2 diabetes is actually a two-part problem. First, the locks on your cells start to get rusty. This is what doctors call insulin resistance. The keys are there, but they're having a really hard time opening the locks. So what does your body do? Your pancreas, that's the factory that makes the insulin keys. It goes into overdrive, but eventually it just gets exhausted and can't pump out enough keys to get the job done.
So what causes this whole system to go haywire in the first place? I mean, what makes those cellular locks get so rusty that the body gets pushed toward this tipping point?
Well, it's not just one thing. It's kind of like a perfect storm of factors. Things like your diet and how much you move play a huge role for sure. But your genetics and simply getting older are also major players. It's this really complex mix of your biology and your lifestyle that can slowly start to mess with that smooth key and lock system.
And you can really think of this as a slow-motion domino effect that can happen over many, many years. First, the locks get rusty and start resisting the keys. Then, the pancreas just works like crazy to compensate. After a while, the key-making factory gets totally worn out. And finally, without enough good keys to open the doors, all that sugar gets trapped outside in your bloodstream.
All right, so that's what's happening on the inside. But how does this behind-the-scenes battle eventually show up on the outside? What are the warning signs your body might be sending you? With all that extra sugar floating around in your blood, your body tries really hard to flush it out. This can lead to some pretty classic symptoms. You might feel super thirsty all the time or find yourself running to the bathroom constantly. And here's the crazy part. Even though there's tons of fuel around, your cells are starving, which is why you can feel completely exhausted and hungry. Other signs, like blurry vision or cuts that just won't heal, are also your body's way of waving a red flag.
But here's the kicker, and this is absolutely crucial. This whole domino effect can be happening silently for years before any of those symptoms become obvious. A lot of people have absolutely no idea their blood sugar is slowly creeping up, which is exactly why being aware of those risk factors we just mentioned is so important.
Right, so because you can't always feel it in the early stages, a diagnosis really comes down to the hard data from a few specific blood tests. A fasting glucose test checks your sugar levels after you haven't eaten for a while. And the HbA1c, now that one's fascinating. It gives your doctor a snapshot of your average blood sugar over the last 2 or 3 months. These numbers don't guess, they tell the real story.
The good news is, a diagnosis of type 2 diabetes isn't the end of the road, not at all. It's a starting point, and there is a clear, powerful, and proven path to managing it and living a very full and healthy life. And it all starts with lifestyle. This is the absolute foundation of management. You can think of diet, physical activity, and weight management as your personal toolkit for helping those rusty cellular locks work better. By making changes here, you can actually help your body become way more sensitive to the insulin keys it's already making. Now, when lifestyle changes aren't quite enough on their own, there's a fantastic range of medical support available. Some medications help your body use its own insulin more efficiently. It's like they're de-rusting the locks. Others might help your pancreas produce more keys. And if that key factory is truly exhausted, insulin therapy can step in and provide the keys your body needs from the outside.
Look, this isn't a one-and-done kind of thing. Management is an ongoing process, and regular monitoring is absolutely essential to make sure the plan is working. Remember that HbA1c test?
It basically acts as a progress report every few months, giving you and your doctor a clear picture of how you're doing, so you can make adjustments and stay on track.
So why does all this management and monitoring matter so much? Well, it's all about looking ahead. It's about preventing the serious, long-term health problems that can come from having high blood sugar day in and day out.
The risks really fall into two big buckets. First, you've got acute or sudden problems that can happen if your blood sugar swings to a dangerous high or a dangerous low. But for most people, the real focus is on preventing the chronic, long-term damage that high blood sugar can cause, often silently over many years.
A good way to think about it is that excess sugar in your blood is like sticky sludge running through your body's plumbing. Over time, that sludge damages the lining of the pipes, and it affects everything, from the tiniest little blood vessels in your eyes, kidneys, and nerves, all the way up to the major arteries that supply your heart and your brain. This is the direct link between diabetes and a higher risk for things like heart attacks and strokes.
And this brings us full circle. See, prevention isn't just one thing. It's a whole spectrum of action. Primary prevention is all about making healthy choices to try and stop diabetes before it even starts. Secondary is about catching it super early through screening. And tertiary prevention? That's about actively managing the condition after a diagnosis, keeping that blood sugar in check to avoid all those long-term complications.
At the end of the day, just understanding what's going on inside your body is the first real step toward taking control. The entire journey, from prevention to powerful management, isn't built on huge, overwhelming changes. It's built on small, consistent choices. So that leaves us with one last thought. What's one simple step you can take today for your health tomorrow?